Ain't she sweet? See her walking down the street. Now I ask you very confidentially, ain't she sweet? I'm Megan Ronnow. I'm a state certified music therapist in the state of Utah, and I'm also a board certified music therapist. I primarily work with the hospice population, and so that's terminally ill. Generally they have 6 months or less to live, and typically they're older adults. When I first walk into a facility, and then even sometimes into people's homes, a lot of people look at me and say, oh, there's the music girl, there's someone here to play guitar. So there are a few misconceptions that people have. A lot of people think that I'm just there to entertain and to play guitar or play the keyboard, but there's a lot more that goes into that. As a music therapist, we're trained to work on specific goals. And with hospice, some of the main goals that I work with are emotional expression and communication. We do a lot of reminiscence as well. I do a lot of relaxation and pain management. I'll often help someone to regulate their breathing using music. I'll be able to help someone with dementia remember a song that their mother sang to them as a child and have them go into depth about that story and the things that song reminds them of. I do songwritings with patients to leave for their family members, and even just sometimes just for them, to help them understand that they're not going to be here for too much longer. And that can be something that can be hard to come to terms with, but music therapy helps in so many different realms, so I'm doing a lot more than just playing the guitar and entertaining someone. So if someone was just walking past, I can understand that it could be difficult to understand that there's a difference between a music therapist who's working on specific goals versus a music entertainer, and both are very valid, of course. But if someone were to sit and listen for a little bit longer, they'd understand that I'm asking the patient questions, so I'm trying to help them be less isolated, or I'm trying to help them reminisce, or to come to terms with what is happening and how to address that and those needs. Or they might see that the patient who had apneic breathing or very irregular breathing is now breathing very easily and rhythmically. And the patient who was very agitated is now calm and relaxed. It's very different, and although there are similarities, and it's hard to necessarily see them right at the surface. So I think it's important to educate people on how much work actually goes into getting a music therapy degree. You know, it is a 4+ year bachelor's degree, and on top of that, included in that, we have practicum hours that we need to complete. And after our schoolwork is complete, we have 1,040 hours of an internship that needs to be completed. So that's typically 6 to 9 months that's done. That's a lot of hands-on time, and then after that's all completed, we still have to sit for the board examination, which is very intense and very time-consuming and very difficult. All of this training goes into what we do every single day, which is a lot more than taking guitar lessons and playing for someone. I truly do care about these patients, and I'm doing the best that I can to ensure that their quality of life increases in the days that they have left, whether it be them emotionally feeling better or smiling, if it's them saying 2 sentences or singing one phrase of one song, or being able to physically see them more relaxed and less contracted. I care about these patients, and I care about the work that I do, and all the training that I've done, the long hours and the long days and long years were worth it, because I am able to make a difference in these patients' lives.